through the WYLT, shoulder rehabilitation and strengthening exercises. This is a great series of exercises for anyone with any rotator cuff issues and a great way of strengthening and stabilizing any scapular-thoracic issues. So one of the first things we'll do is we'll have the patient adopt an athletic stance, so feet roughly shoulder width apart. We're going to have a slight bend in the knees. We're going to ask our patient to engage her brace. And in this instance, we're just going to be using some smaller hand weights. With this exercise, you don't often go above a 5-pound dumbbell so that it isn't too stressful on the rotator cuff. So we're going to start with a W. So the patient is going to draw her arms upwards, rotate the shoulder back, and then pull the elbow tips down. A nice visualization for this is that the patient is in between a very narrow corridor so that the weight isn't being taken too far backwards, which will stress the shoulder joint. So okay, away you go, Sarah. So again, the arms coming up, back, and at this point she'll be locking in her lat muscle, and that will conclude the W. We're now going to perform the Y. So we're going to have the patient hold the dumbbells to the front, and we're going to have her raise the dumbbells up so they're passing through my hands, and again she's going to lock that lat muscle in here. For our flexible patients, making sure that they don't take the shoulder and the arm too far back and hyperextend, so instruct them to stop around about here. The aim is to strengthen and stabilize. Okay, away you go, Sarah. So Sarah is braced, knees bent, she's breathing, she's stopping way before the end of her anatomical range of motion, and with slow, controlled movements. That's the Y. The L exercise, she's going to have the dumbbells to the front with her thumbs pointing together, and she's simply going to draw her elbows up and rotate the weight back. Again, with our flexible patients, being sure that the weight doesn't come too far backwards. She will be stopping roughly in the plane of her body here, and then rotate the weight anteriorly and down. There you go. One point you may have to keep an eye on with your flexible patients is as the weight comes up, you may have to have them bring their arm forward slightly, allowing for the natural curvature of their rib cage. Okay, away you go, Sarah. And that would be the L. We're now going to perform the T. So Sarah's going to have the dumbbells to her front, thumbs forward. We're going to keep a slight bend in the elbows so that there isn't too much stress being placed via a straight arm into the glenohumeral joint. Sarah's going to keep her brace. She's locking her lat muscle down, and now she's simply going to raise the weight up to the side and stop it roughly in this plane. We're not going to go above it. We're keeping the bend in the elbow so as to not stress the shoulder joint too much. And again, this is why we're only using smaller hand weights as well. And back down. She's maintaining her brace. She's breathing through the movements. And again, depending on the patient's ribcage shape and spinal postures, as the person brings the weight up, you may have to instruct them that they have the arm slightly anteriorly, or they may have to bring it back just so, being careful not to exacerbate any impingement issues. Okay, away you go, Sarah. Perfect. And that would be the final exercise of the WYLT, shoulder rehabilitation and stabilization exercises.